So the big question is, when do we use tape? What is the purpose? What is the intent? And these are what I've identified as the three most frequent uses for taping. First one being circulation, second being tactile neuromotor cueing, and third being stability. So now let's go over each one of these in a little bit more detail. So circulation should be obvious to most of us. If we have an injury, there tends to be some resulting swelling. K-tape can help to reduce the swelling. Now, the other thing is, and this probably isn't as much use to you as it is to other medical or athletic professionals, but it can also be used post-surgically when you have edema resulting from surgery. So that's a good thing to kind of note. I don't know if maybe some of you have, knee replacements coming up, or you have parents with joint replacements or that sort of thing, but it can be used post-surgically as well. But we don't want to just use circulation to reduce swelling. Increasing circulation increases your blood flow, which is your healing nutrient. So K-tape is great for helping to facilitate that healing of an injured site as well, because we're increasing the blood flow to that area. In fact, a lot of people, when they wear it, they say, oh, that area feels kind of warm. Well, that's because of all of that increased circulation and blood flow going to that area. The second one is tactile neuromotor cueing. Now, these may be some unfamiliar terms or terms that we're somewhat familiar with, but we're not sure how that applies to taping. So the thing that we really want to emphasize with taping is you, depending on how you tape, can either help to activate or facilitate a muscle, or it can have the opposite effect where you inhibit a muscle. So if you have an area or region that's maybe sore from being overused or is naturally overactive and you're trying to get it to calm down, that's when you're going to use an inhibitory taping. On the other hand, if you have something that's just not kicking into gear and maybe other things are having to compensate, or you're trying to wake up a muscle that maybe hasn't been used in a while, maybe due to an injury or again due to a surgery, then you would use facilitation taping. Now we'll get into how to do this a little bit in this course, but it all depends on what direction that muscle pulls and what its main purpose is. The last one is stability. And I feel like this is the go-to for most people, because when we think of taping, many people think of that white athletic taping that trainers used to use in high school when you would roll your ankle or that sort of thing. K-tape can have similar effects, but it is certainly not as strong as the white tape, and that is not its primary intention. The primary intention for K-tape is to gently lift the skin away from the fascia to allow for more circulation. These other things are secondary. So when you stabilize with K-tape, it's not going to be super stable. So you don't want to use this on something that it has to be 100% stabilized, otherwise you can't walk on it, or it needs to be stabilized, otherwise you can't use it. This is for gentle stabilization. The other thing is, I find that the stabilization is so gentle that it's actually best for just some mental cueing, or again the neuromotor tactile cueing for that region to maintain stability. It's not something like a boot or a cast by any means, and so when we say stabilization, it's minimal stabilization, just enough to help you with function and help you with maybe some of the higher motor skills that you may need during a workout or that sort of thing.